Uterine fibroids are benign, which are non-cancerous tumors of the uterus that originates from the vasculature of the uterus. These are very common tumors of the uterus. In some women, especially with larger uterine fibroids, it can cause a lot of symptoms, and most commonly it causes heavy menstrual bleeding, pelvic pressure, and pain. The symptoms of the uterine fibroids are broadly classified into bleeding and bulk symptoms. The bleeding symptoms include, obviously, heavy bleeding and heavy clots. Sometimes the bleeding is so heavy that they bleed through multiple tampons and multiple pads, requiring a change of tampons and pads anywhere from like every 15 minutes to an hour. The bulk symptoms in turn includes pelvic pressure, increased frequency of urination because of the pressure exerted by the uterus on the bladder, and back pain, and sometimes even constipation. So why the uterine fibroids cause symptoms? During normal menstruation, the endometrium sheds and the uterus contract to limit the amount of bleeding. The contraction can be felt as the regular menstrual cramps. When the fibroids, which are much firmer than the uterine musculature itself, are present, the uterus is not able to contract effectively, and it decreases the ability of the uterus to limit the amount of bleeding. The uterus still tries to contract and limit the amount of bleeding, which causes more severe cramps and excessive bleeding.